As you know, my name is Chase. I will be your nurse practitioner student today. And today we are going to be doing a musculoskeletal exam. So before we begin, I would do hand hygiene. And don't mind the service dog there. But, and then as well, do you consent to being filmed for this this assessment? Okay. And having it posted to YouTube?
Mm-hmm.
Okay, sounds good. So first I'm going to take a look at your fingers. So basically I'm just going to look for any abnormalities, any swelling, any redness or anything like that. Then I'm going to look at the interphalanges, the metacarpal phalangeals, and I'm going to palpate to see if I can see any or feel any swelling, any pain as I do that.
Nope.
Okay, can you squeeze my hands for me, assessing range of motion, and then open your hands wide, and then kind of go abduct, abduct. Okay, excellent. Next, I'm going to assess your wrists. So again, just looking for any inflammation, anything like that, which I'm not seeing. I'm going to feel them. Any pain as I do this. Okay, can you bring your kind of flex? Yeah, okay. And then put it down. Okay, then again, just with your wrist, and then in. Okay, and then we're going to do a couple of specialty tests. So kind of make a stop sign for me and do it tight like that, and I'm just going to tap under here any pain. So that's called the Tinel's test. And next I'll have you kind of bring your hands in like this and then hold them together. Any pain in your wrist, this is checking for carpal tunnel. And normally you would hold that for 40 to 60 seconds, but for the purposes of this video we can cut it short. So next I'll take a look at your elbows. So with your elbow you can kind of just relax it. So again, kind of looking for any swelling, inflammation, any nodules, any abnormalities, which I'm not seeing. And next I can just palpate the olecranon back here, and then kind of the lateral and medial epicondyles, and I would do this bilaterally, but for this video I'll just kind of show on this left arm. So any pain as I'm doing that.
Mm-hmm.
Okay, this on the lateral side, this is where you would assess for tennis elbow. On the inside is where you would assess for golfer's elbow. And so let's do some range of motion as well here. So so I'll just have you flex and then kind of extend your elbow. Okay, and then go in, kind of in and out, abduct, adduct. And then I will have you put your hands up, supinate, and then pronate like this. Okay, excellent. Any pain doing any of those? Okay, excellent. So next I will do the shoulder, and again I would do kind of both shoulders, but I will, I'll just do one for now. I'm just going to kind of bring that up. So pretty much I'm going to find the clavicle and follow it up here to the AC joint, and then I will go to the coracoid, process any pain there. And again, before I would do this, I would kind of assess the shoulder to see any bulging, if it dislocation, anything like that. So now I'm feeling, and I will feel the bicep groove here. Any pain there? Okay, and the coracoid, and then the deltoid busa, I think, and then the tubercle, the humerus tubercle there, and then just kind of assessing around for any pain as I do that. Okay, excellent. So let's see. Okay, so and then I guess I can kind of do that on this side just to kind of feel. All right, any pain doing that? Okay, so next I will have you flex your arm, so bring it back and then kind of extend around, and then I will have you abduct away like that, and then bring one arm across and do the adduction, and then the other arm. Okay, excellent. And then I'll have you externally rotate and then internally rotate your shoulders. Any pain doing that? Okay, next I'm gonna do a special test. It's called the empty can test. So pretend like you're emptying cans in front of you, and then I'm gonna push down and resist any pain there. Okay, excellent. Testing for rotator cuffs. Okay, next I'm gonna kind of assess your neck. So kind of your neck and kind of some of your upper spine at least. So again, kind of looking kind of at posture here, and then any abnormalities, any potential nodules or asymmetry, and kind of with the shoulders, I'll do more of an assessment, but again, kind of assessing for any symmetry, asymmetry, which I'm not seeing any. So with the neck, I'm going to palpate kind of right here around your clavicle, any pain there. Okay, and then I'm going to kind of palpate back here on your cervical and up on your neck, any pain doing that. And then these supporting muscles of your neck, any pain as I palpate. Okay, excellent. And then I'm also going to palpate your temporomandibular bone and joint here. Any pain doing that. Okay, and I'll have you open your mouth. And it's going to kind of an interesting one, but I'll have you put 3 fingers in your mouth.
Okay.
Like that. Okay, excellent. Just showing that it can open. And then with your mouth open, you don't have to have your fingers, but just go side to side and kind of assessing for any popping or anything like that, which I'm not feeling. Excellent. So next, let's do some range of motion of your head. So I'll have you nod up and down, and then kind of bring your head from shoulder to shoulder, and then rotate side to side. Excellent. And next, I'll kind of have you extend your head, and I'm going to do, it's called a Sperling's test, and this is to check for compression and any pain as I do it. So kind of bring your head back, and then to the side, and then I'm going to kind of push down. Any pain?
No.
Okay, and then on this side, again, same thing. Any pain there?
No.
Okay, and I wouldn't do that on an elderly patient. But excellent. So let's move on to your toes and your ankles. Okay, so looking at toes, again, kind of assessing the joints, the interphalangeals, the metatarsals, for any swelling, any abnormalities, which I'm not seeing. And then I'm going to palpate as well. Any pain while I do this? Okay, excellent. I'm also assessing, just inspecting for bunions. I guess I could look for calluses, any warts or anything on her toes, which I'm not seeing any. So I will have you. I'll have you kind of curl your toes, and then kind of bring them out wide. Excellent. And then kind of invert and your foot, and then kind of evert it. Excellent. So that's great. And next, I will assess your ankles, and so I'm just gonna kind of look here at kind of the outer edges of your ankle, your joint there, and then your Achilles, and I'm gonna feel any pain as I do this, feeling for any swelling, again, any abnormalities, which I'm not feeling. So next, I'll have you plantar flex. So point your toes, and then dorsal flex them up. Okay, and then I'll have you kind of go in kind of a circular motion. Excellent. Any pain as you do that? Okay, excellent. So next we have the knee. So for the knee, I'll have you lay back actually. Okay, so with the knee, I'll show on one knee, and then we can kind of go from there. So again, just kind of looking at the knee, any bulging, anything like that. Gonna look at above the knee, or gonna feel above the knee and on the sides, the lateral patellar sides here, for any pain as I do this. Okay, excellent. So that's great, and I would do this on both sides for pain, and then as well I would assess behind the popliteal fossa for any pain as well. Any pain doing that? Okay, excellent. Okay, so next I'm going to do some special, or I guess we'll do the range of motion first of your knee. So I guess you can do it one at a time, but kind of flex your knee and then extend it as far as you can, and then do it on the other one as well, and extend. Excellent. Any pain doing that? Okay, and kind of bring it out and in. Yeah, that's perfect. And then I guess with the other one, kind of sideways. Okay, excellent. So next I'm going to do some of the specialty tests. So the first one, we'll go on the outer knee here and the inner knee, and I'll kind of push against it. This is called the valgus. Any pain as I do that? Okay, and then the varus is on the inner knee and the outer ankle here. So any pain as I do that? Okay, excellent. And then I could again do that on both sides. I guess I would assess for pain doing both of those. Okay, so any pain on that one? Okay, so next I'll do the drawer test. So I'm going to have you kind of bend your knee, and I'm just going to kind of pull it towards me and push it kind of like a drawer. Any pain as I do that? Okay, excellent. And then I would do that again on the left foot as well. So next I will do the Lockmans, which is similar to that last one. So I'm going to kind of hold it, and I'm going to kind of pull and push and then extend. Any pain as I do this? Okay, and I'm just kind of pulling on the tibia and pushing, extending out for the Lockmans test. And again, I would do that on the left as well. So let's see. Or I guess, I don't know. I think that was actually the McMurray test, but and Lockman's is more of holding like this and then kind of pushing in and pulling out on the tibia. Any pain doing that?
No.
Okay, sounds good. So, and again, I would do that on both knees. So next, let's assess your hips. So I'll wait to assess the symmetry when you're standing, but so we can kind of pull these down, I guess. And so with the hips, I'm going to kind of assess all surfaces of the hip joint. So kind of the iliac crest, posterior, and the anterior side. So I'm just going to feel the hips. Any pain as I do this? And I guess before I would do that as well, I would assess for any bulging, any discoloration, any swelling. And then yeah, I'm just going to kind of feel around, and I'm going to feel for this this joint here, which I'm not feeling anything, any pain as I do that. Okay, excellent. All right. So yeah, kind of feeling anterior, posterior, and on top and kind of around the hip there. So let's see. So the next one, to test some of your hip motions to see if you have any discomfort. So I'll have you bring your knee to your chest and pull it tight. Does that hurt at all?
No.
Okay, and then we'll do it with the next one. Any pain?
No.
Okay. So next we'll do the Patrick's test. So this one, you'll kind of have this knee up and then bring this one over here, and then I'm going to kind of push. Does that hurt?
No.
Okay, excellent. And we'll do it on the other side as well. Any pain there?
No.
Okay, excellent. So next, let's do a spine assessment. So I'll have you stand actually for this one, and we'll kind of turn this way. So pretty much, again, I'm kind of looking at posture. I'm assessing symmetry of shoulders as well as hips, which is great. And then I'm also going to kind of assess your spine. So I'm going to pull your shirt up a little bit. And so basically I'm looking at the curvature of the spine, looking for any abnormal kyphosis or lordosis, which I'm not seeing any. And then just visually, I'm just looking to see if I can see any scoliosis, which again, I'm not seeing any there. So then I'm going to assess this, or palpate the spine. So I'm just going to kind of feel the spine itself, and all the way through, any pain as I do that, and then the supporting muscles of the spine as well. So any pain here?
No.
Okay, and I didn't see any bulging or anything like that. So next, I will have you kind of bend over and, and I would kind of just look for any scoliosis here, which I'm not seeing. Excellent. And then, again, kind of just assessing the symmetry, which both shoulders, hips, symmetrical. So next, I'll have you lay back down. Oh, actually, before I do that, let me just percuss your spine. So I guess I can do it kind of with the flat. Any pain as I do this?
Mm-hmm.
Okay. All right. And next I'll have you lay back down, and we'll do the straight leg raise. This is assessing for any lower back pain. So any pain there?
No.
Okay. And then same thing here. Any pain in the lower back?
No.
Alrighty. Well, I believe that concludes our musculoskeletal assessment, so thank you for your help.
Yeah, you're welcome.